Howdy, everyone. Matt here. I got a question for you. What do you say when a patient calls you something like a physical torturist? Or what do you do when a patient threatens physical harm upon you? Let's talk about it. All right, everyone. First and foremost, let me introduce myself. My name is Matt. I am Matt the PT, coming at you with another video, another topic of something from the physical therapy world. And this one, this is some of those negative words that patients say toward us. And this came about from a podcast. It kind of started from a podcast. So I was talking with somebody and they were saying, yeah, a patient have called me a slave driver in the past. And we talked about some of these aspects of it. And it really kind of stimulated this thought about just the whole situation of some of the language that gets used toward us. And I'm talking about, and I do feel this is kind of a spectrum of things. One, patients calling us, like a physical torturist, a physical terrorist, a slave driver, like that patient had mentioned, a drill sergeant, in the things that they call us. So you're calling your therapist a name, because of what they do. And I do believe there's even another aspect of it. And it's that thing of when patients say stuff like, oh, I go to therapy and y'all just going to hurt me. Oh, I'm just hurting so much after doing my therapy. I'm just hurting. In that language they use. And then the last aspect of it, and I believe this is a big one, and it needs to sit upon its own realm to discuss, is when somebody threatens you. So saying that, if you touch my shoulder, I'm going to hit you. If you hurt me, I'm going to hurt you. And using that language. And I believe that that's something to kind of talk about on itself. But overall, for this whole spectrum, which I feel like, kind of the name calling can be kind of funny and joking, to this is really serious, that we need to address it. That we really need to set a boundary, set a line about what is appropriate to say and what isn't. Now, I'm not saying to be, Captain No Fun, where it's like, no, you can't do any of it. And part of some of this is in a joking manner that you have a rapport. And I'm not talking about that. And you understand when you are working with your patients, when you've built a rapport, that you can say things to one another and it's not personable. It's not hurting them. They're not taking that and going on. And if it even if it is happen to be something that maybe stings a little bit, you're both very open to saying, hey, that wasn't right. And you can move past it. But I want to start on that first part of it. They'd be calling the names, being called names. And I know I have made jokes about that in the past. If you looked at any of my comments, or excuse me, my content, I have made that joke. A patient calls you a physical torturist, this and that, and you just created that. And I've been thinking about it. And if you're someone who would understand this better than I am talking about it, please share about it. And of course, I want to hear your thoughts and opinions and beliefs and all of that down in the comments. But really saying, like, is this a way that a patient is trying to have some sort of control in the situation? And people have talked about that as a healthcare provider, you are in a position of power because you are the authority in the situation. The patient's coming to you, they have pain, they have an issue, they have a limitation or something. So you are the one in charge of getting them better. So you hold more of the power in that situation because you can control so much. And is using language like that to call that person this thing a way that you can hold some sort of control? So I have some sort of control because I can call you this negative name. This negative name, this name that doesn't say that you're this helpful person, but you're more of this other person that can be viewed a little bit differently. And I think that even trickles over to the other aspect of it as well. Like when a patient says, oh, my therapy is, oh, you're going to hurt me in here. Oh, I'll leave out of here and I'm just hurting. And when they say this, I understand it. It's not a hurt as in you like hurt yourself. So say you fall down some stairs, you are hurt. You're in a car accident, you are hurt. That's one separate kind of hurt because there's all different types of pain and things like that. That's separate. But more of like, say that you did a hard workout, you did a hard run, you did a hard gym session, and you're like, whoo, I am hurting. And it's not a like sharp tearing, ripping, stabbing. It's like, I'm tired. We get some inflammation going on, which is not a bad thing because you're causing a little tissue trauma, but you're stimulating growth. And you're like, I put myself through this hard workout. I've caused myself pain. I've hurt it, and I'm going to come back stronger. And it's more along those lines that they've said, oh, you're going to hurt me. And I've looked at that to say, like, is this person trying to put themselves in a position of saying, well, I am weak and vulnerable. And, maybe it is kind of a victim. I don't even know if that's the correct word to even utilize in this situation, but just saying, I am the helpless one, and you're the one that are putting all the work and things onto me. You're inflicting and making me hurt with it. This is supposed to be good and happy, but I'm not feeling those things. I'm not feeling these happy, good things. I'm feeling soreness. I'm feeling tired. I am feeling achy, and you are hurting me in those situations. So you are in this position of punishing me. And, maybe I'm not even saying that right, but just let me know what you think about it. If you had a patient use some crazy language like that, hit that thumbs up button and subscribe to the channel. Back to the video. And the last part of this is way more serious. And that's someone saying that if you hurt them, if you touch this knee that I've had the knee replacement on, I am going to hit you. Or if you bend my knee that I've had the surgery, I am going to hit you. And this can be said in a playful manner. I've had patients who've kind of jokingly said that, oh, if you do that, I'm gonna swing back. And it's like, okay. And I've made the jokes about it. There's a video of me of, a patient taking a swing at you and you're just documenting, increases in range of motion. But there's also times when people are serious on there. They're saying, like, if you touch this, I'm going to put my hands on you. And that's a real situation. And we can all kind of just discern this. And I really think with all of this on here, like with any of these situations, from the very, joking, you're a physical terrorist, that we need to communicate. Like, there needs to be something where it's like, okay, stop. We're going to stop right here. And I want to understand why you just said that. So starting off in that beginning part of it, if somebody says, they call you, oh, you got the physical torturist, to go, hang on. Why do you feel the need to call me that? Why do you feel that isn't something appropriate to call me that? And I think it's just to get that dialogue from them. What are you feeling to express that? Okay. And I mean, in listening to them, because maybe they're just saying it jokingly. They're saying a joke, and it's like, okay, we get that that's a joke, but I would ask that you please not use that language, to not say that, because that is not my goal, is to hurt you. And again, that kind of goes to the second aspect of it. If someone, oh, I'm here at therapy's going to hurt, it's just you're just here to hurt me, and bringing that up. And I've done that with patients. I remember once I had a lady, I called in from the waiting room, and she goes, oh, you're going to hurt me. And I said, hang on. How do you know that? And she goes, well, my husband told me that. I said, okay, well, has your husband worked with me? And she goes, well, no. I said, well, how does he know that? She goes, well, he doesn't. I said, okay, but you're coming in with pain. Why does it make sense to cause more pain? Why should we hurt you more to try to get rid of this pain? And she started really thinking about it. And I said, yeah, that's not the goal. That's not the point of what we're doing here, is to sit here and inflict more pain upon you. Because think about it, if you are having, if you touch something that's hot, or if you're having or dealing something that's painful, you're going to avoid it. You're going to withdraw away from it. And is that what we want to do to get you better? And this really changed the thing. Now, I can't understand when people talk about, like a deconditioning, or maybe you're much further along in a post-surgical care and somebody's like, oh, you're hurting me. And then there's someone who hasn't really worked out. And we see those patients. There's someone who hasn't worked out a lot in their life. And so when they're, when you're doing rehab, you're exercising and they've never felt this before. And they're like, whoa, I'm hurting because I'm going through all this physical activity. And that can really be a separate thing, but explaining the physiology of what's going on. Like, yes, that's called DOMS. That's muscle soreness. Yes, you have inflammation. You haven't done this stuff before. You're going to experience, this is going to be a common response no matter what you've done. And you can relate it over to other things, like, oh, have you ever worked out in the yard, or you had to move stuff from one house to another, and you got it's along the same way. And it's opening that dialogue to say, why are you feeling like that? Why do you feel the need to say this? And, yes, it may be joking, but, maybe you don't find it funny. Maybe it could be negative that's being told to other people. And I think that's a big aspect of it too, to not let it go over to other people, because that could then cause another person to avoid seeking care. Because if you're telling other family members, oh my gosh, this was the most painful thing of their life, well, I don't want to do that. I don't want to go through that. So they can avoid it. And I think people kind of forget that carries over to other stuff. Now, that last one, I really believe that needs to be taken serious. Now, in the video I saw that kind of sparked this was a physician. I can't remember if he worked in urgent care or something like that, but he said a gentleman came in, had like a really inflamed shoulder, and he's like, I'm going to examine him. And the patient said, if you touch my shoulder, I'm going to hit you. And he goes, wait a minute. Why do you feel that you need to do that? I'm here to do a job. I need to do that. I'm not here to hurt you. So you are going to physically assault me, yet you've come here for my help. And it really just kind of sparked this thing that like they're angry and they're frustrated at a situation, and it just kind of got, and it changed the whole thing. And I think if we have a patient that threatens in that manner, there does need to be a hard stop. And will say, I think there is a continuum of that. If somebody says it in a playful manner, I do think we still have to have a hard stop and say, all right, hang on. Why do you feel the need that was an appropriate response? I don't want to hurt you. Okay. I may take something too far. Maybe I bent your knee too far. Maybe I, stretch your shoulder too much. And I did not do that purposefully. I did not mean to do that, to just hurt you or to do that. And so why do you think that that's a response, is to be violent toward me? And I think that can change some narrative. Now, I will say, if somebody is serious about it, that if someone is saying, if you do this, I'm going, to be violent in some manner, that requires like hard stop, bring in management and say, okay, management's going to be involved in this. You've threatened me with physical harm. We are documenting this, and management needs to be on the side. I have heard this from people complain about their management that don't put a stop to this, that just say, well, what could be, it's like, no, that if you are going to be physically violent with staff and you're serious about that, let's talk about it. Why are you feeling the need? Because again, maybe person's frustrated at the situation, or maybe they're getting bounced around a whole lot. Okay, we understand that, but that's not an appropriate response. But if they're going to say like, well, I'm going to do this, okay, you may leave the facility, you may go to somewhere else. We will just document it, and that needs to be documented, and people held accountable for that. Held accountable. Like if you're going to threaten somebody in healthcare with physical violence because they are trying to do their job, there's no place for it. There's none there. This is something, people may know more about this than I do, of like why people do this, the psychology behind it, why they may make this jokes, or they say these comments. But really, it's going to be a part of what we do. Now, we don't need to be on the other side of that and dealing with consequences from people lashing out at us. But I do think it does spark a conversation. And I have started doing that. If somebody says something to me like that, like, hang on, why do you feel the need to say that? What are you thinking? What are you experiencing? Do we need to change something? Let's talk about this more. And if you don't feel comfortable and you still feel like this is the appropriate response, do you need to see somebody else? Do we need to refer you over to someone else? Is there someone else that you would feel more comfortable with doing your rehab? Because we need to put you into that situation so that you have the best chance for a good outcome. And of course, physical violence is never an answer. If someone is being physical, it needs to be handled appropriately, going through the appropriate channels with wherever that you work, whatever that needs to be handled, and that doesn't have any place in it. So if a patient wants to be physically violent with a therapist or whatnot, no place whatsoever, because that pushes therapists out. Again, you can cause a harm to the therapist, which can affect their ability to work, and then also push them out of the profession completely. And this does not belong in there anyway. So with all that being said, let me know your thoughts, opinions, and beliefs down in the comments below. If you enjoyed the video, hit that thumbs up button and subscribe to the channel. It doesn't cost you a copay. And until next time, take care of yourself. Take care of your patients. I'll see you then.